presentation.
Actually, Amit, would you mind hitting record on your end? Amit. Amit, if you're speaking, you're on mute.
Sorry. So it looks like it's already recording. Do you want me to stop and start it, or?
Does it let you start and stop it? Because I just want to make sure that it's on your end and that I'm not.
How about I'm going to start it again?
Okay, perfect. Thank you, Amit.
No problem.
Right. Now I'm going to go ahead and admit everyone, and we can go ahead and get started once everyone's in the room.
Hi, Maria.
All right, well, hi everyone. Today we're going to be talking about making EHR data more available for research in public health, which we've been calling MedMorph. I'm Maria Michaels. I also have a co-lead on this project, Wendy Blumenthal, and our subject matter expert that you'll be hearing from a little bit later is Nagesh Bashyam, which we call Dragon. So just as a quick overview, we will have about a half an hour of presentation, and then following that, we'll have about 4 hours of testing. So just to give you an idea of how this full MedMorph session will take place. And then for the presentation portion, we're gonna have a little bit of background on MedMorph and share some of our accomplishments from the past year. And then we'll go into testing the MedMorph reference architecture implementation guide, a little bit of a report out on some past MedMorph Connectathons, and then next steps for the upcoming year. So to start with, I'll just jump right into the background. We're gonna zoom out to about a 50,000 foot view with the data lifecycle and its impacts to the public's health. So this data lifecycle is this notion of knowledge to action to data to information and back to knowledge again. It might come with other names. So you might have heard it as the evidence lifecycle, the learning health system, and several others. But either way, it kind of represents this cycle. And so if we arbitrarily sort of start in the top left, the knowledge would include things like guidelines, recommendations, guidance, or public health policies and mandates. And all of that knowledge really needs to be able to be delivered in an actionable format to the point of care for emergency response, maybe at public health departments or other community services, really just all the places where the action happens. And those actions and the health impacts and outcomes that result from those actions generate data. That data then resides in systems like EHRs or registries, a variety of different kinds of information systems. It could even include things like patient-generated or reported data. So the data itself, though, is not all that useful unless you can analyze it to be able to turn it into information. And you can do that through a variety of different data science techniques, analytics, linkages, visualizations. And once you have this information, you can determine whether the scientific evidence needs to be updated. Now, all of these different parts of the cycle have sort of traditionally been worked on in silos and kind of disconnected. And so we want to be able to better connect these, because this is really how we're going to be able to improve the public's health through the data and knowledge that we are able to garner. And we think a good way to do that is using fast healthcare interoperability resources, or FHIR. The MedMorph project focuses on the action to data part of the life cycle, but we are taking all of those other portions of the cycle into account, so that ultimately what we're working on really will fit in with the rest of the cycle and help kind of create this virtuous cycle that moves along smoothly and really helps improve the public's health through science. So a little bit more about the project. It is funded by the Patient-Centered Outcomes Research Trust Fund, which is through the US Department of Health and Human Services, Assistant Secretary for Planning and Evaluation. The total project timeline is 3 years. We're about halfway through that. And the main problem we're trying to solve is that patient-centered outcomes researchers and public health professionals need better ways to get data from different EHR systems without posing additional burden on healthcare providers. And so in order to help solve this problem, our goal is to create a reliable, scalable, generalizable, configurable, interoperable method to get the EHR data for multiple use cases in public health and research. And in order to achieve this goal, the objective is to develop a reference architecture and demonstrate a reference implementation, including developing implementation guides. In order to help us inform this reference architecture, we have put together a technical expert panel, or TEP, with a lot of different participating partner groups. And I'm not going to read this slide to you, but I hope you'll notice that by looking at this list of partner groups, we really try to think about all of the relevant perspectives to help us build out the reference architecture in a way that can be applicable to lots of different use cases. And as I mentioned earlier, that can connect back to those other parts of the data lifecycle. So a little bit more about the work groups. These consist of various members of our TEP. Starting with our use cases, we had 3 use case work groups to start with, one for each of 3 use cases that we're modeling. And we selected these use cases because they're fairly representative of what we do in public health pretty broadly. So an infectious disease, a non-communicable disease, and a non-disease or condition-specific use case. And then across all of those, we also thought about sort of a 4th use case, which is research. So you could do research on really any of those particular topics. In those work groups, we had subject matter experts for the topic of the use case, as well as a variety of technical experts. And in that way, we are able to really think through the requirements that are needed for each of those use cases. Then we started up 3 technical requirements work groups. And each of those focused on a different technical aspect that will ultimately feed into the reference architecture. So we thought about data flows and clinical workflows, data standards, and then a reference architecture, authorities, and policies. And now we had kind of a converse makeup where we had technical experts that knew each of those technical areas fairly well, including mixed in with some other technical experts. But then we also had representation across all of the use cases, and these 3 use cases, but additional use cases, so that we could really think about all of the different ways that we can make this reference architecture broadly applicable. Each of those sets of 3 work groups got consolidated. And with respect to the use case work groups, they were consolidated in particular so that we could look at the commonalities across the work groups or the use cases, so that we could help identify the requirements that were common across all of them. And that was the starting point for the reference architecture. And similarly, on the reference architecture work group, we took into account all of those different technical aspects in the common architecture that we were developing. In the meantime, we also had an evaluation work group, and that work group is working on planning some evaluations, starting with a short-term evaluation that will take place during a real-world pilot. And the real-world pilot in this diagram is represented at the bottom there with the blue sort of agile development cycles. That will take place shortly. In fact, I will just say we are about here, and we're working on identifying our pilot sites for this real-world pilot. Then that short-term evaluation, as it's being executed during the real-world pilot, will also help inform a long-term evaluation plan. That long-term evaluation plan will then become part of a roadmap. I'll tell you a little bit more about it shortly. So here I'm going to kind of build out a slide of kind of the overview of the whole project, starting with where we're ending. So we will ultimately have deliverables of a reference architecture and reference implementation, which will include open source software and validated implementation guides. The roadmap that I just mentioned is going to focus on things like scalability and sustainability, and include things like that long-term evaluation plan. We started on a foundation of standards that are supported by Health IT certification. starting with the things like the Common Clinical Data Set, which is now the US Core Data for Interoperability, APIs, FHIR, and so forth. We also have our technical expert panel, our TEP, that consists of folks like end users, data recipients, and other stakeholders. And as I mentioned earlier, other representatives from additional use cases that can help inform the types of requirements that we need even more broadly than the 3 use cases we modeled to begin with. Again, those 3 use cases include chronic hepatitis C surveillance, cancer reporting, and healthcare surveys. And we're developing technological strategies for scalability and extensibility in the reference architecture. And as I mentioned, we are developing implementation guides, one for general use, that would be our MedMorph reference architecture implementation guide, and Dragon's going to be going through some of the details of that in a little bit. And then one for each use case if they need it. And by that I mean, we'll have sort of a content implementation guide for each of the use cases, but one of the tenets of our approach is reusability. So if there exists another content implementation guide that a use case can use, we want to try to leverage that as much as possible. So in the case of chronic hepatitis C surveillance, the electronic case reporting implementation guide, and particularly the initial case report implementation guide, really fit the use case quite well and cover all of its requirements. So we will be using that as the content implementation guide for that use case. We will be testing and already have been testing. In this case, so far, we've been testing through Connectathons, the reference architecture components that we've developed so far. We'll continue to do so in the real world pilots that I mentioned. And in the real world pilots, we'll start with that hepatitis C use case since we essentially have a content implementation guide already for it. Those real world pilot sites are sort of selected from this notional idea at this point anyway of a national test collaborative where you would think of this as kind of having a variety of different kinds of organizations like the clinical sites, their EHR platforms, other testing partners like public health agencies and health departments, registries, health IT developers, and so on and so forth. Once we have our sites, like I said, we'll be conducting that real world pilot, and that's going to include some of the evaluation that we've planned for, specifically the short-term evaluation plan. And as we measure and evaluate in those real world pilots, it'll help inform a long-term evaluation plan that will be part of the roadmap. So now a little bit about what we've done in the past year. We had 137 community members that participated in our TEP, and that included our use case work group, which included a submission to the US CDI process. I'll describe that in a little bit in more detail. A reference architecture work group and evaluation work group. Our full TEP held 8 TEP meetings. So this is all of our TEP members across all of the work groups met 8 times in 2020. And a majority of those included presentations from a lot of different other programs and projects that we wanted to learn from so that we could build from what they've succeeded with, learn their lessons, and then ultimately help fill in any gaps in the MedMorph reference architecture. So here we've got kind of a listing of the different programs and projects that came and presented to our TEP. And we took, like I said, the lessons learned, built on what they have, and identified gaps that we took back to our work groups to work into the reference architecture. Now, our use case work group, as I mentioned, was established as 3 use case work groups that focused on each use case separately to start with, and then came together as a consolidated work group. We completed initial drafts of 3 model use cases, and I've already named those for you. In order to do that, we went through the use case description, problem statement, goals, user stories, scope, actors, abstract models, use case flow and diagrams, data set requirements, policy considerations, and non-technical considerations. So we did that for each of the use cases. And there were some others I mentioned that other use cases were also part of the TEP. So some of the other projects and programs that we're working on other use cases also kind of follow this process in parallel so that, again, we're modeling even more use cases than the initial 3 that we started with. We then crosswalked to identify the commonalities across the use cases. And again, pulled in some of that feedback from those additional use cases that were kind of working in parallel with us. We identified common data elements, which we ultimately submitted to the US CDI process for those that were not already part of the US CDI. And that came to a total of 76 data elements to be considered. It looked at what was necessary as part of the submission and responded to any comments from ONC during the submission process. And so now we're in the process of actually looking at what they've proposed for version 2 and providing additional comments there. Our reference architecture work group did a lot of work related to the HL7 components of this project. So submitted a project scope statement that was accepted, worked on identifying 5 common workflows and describing their actions and interactions, actors and interactions, prepared a notice for intent to ballot, developed an implementation guide for the reference architecture, and then tested several of the workflows during Connectathons in November and January, and then prepared for the January ballot at HL7. The evaluation work group completed long and short-term evaluation logic models, and then completed evaluation plans on the short-term side, which, as I mentioned before, will be executed during the real-world pilots, and are now in the process of developing requirements for a long-term evaluation plan, which will be further informed by the results of the short-term evaluation plan. And those will be incorporated into our roadmap. Now, with respect to HL7 activities, we met with the public health work group throughout the year. That's our sponsoring work group for MedMorph, and worked on all of the various things that you see listed there. We conducted a specific MedMorph specific Connectathon in November and participated in MedMorph ECR Connectathon, that's electronic case reporting, in January. So we had some planning activities during 2020. And we also presented at the September 2020 HL7 work group meeting. So now I hope I will be turning it over to Dragan to go through some details around testing the MedMorph reference architecture IG. Dragan?
Yeah. Thank you, Maria. Happy to walk through. So, yeah, like Maria said, we've been working over the past year trying to develop the reference architecture and the reference architecture implementation guide. So what we're showing in this particular diagram is kind of the actors that we have. These specific actors form, what we call as an abstract model, and we have interactions between all these different actors. So, on the far right, we have the public health agency or a research organization that wants to receive the data, and they will be interacting with a number of other actors. Namely, for example, they would be working with a trusted third party sometimes to receive the data, or they would be receiving the data directly from a healthcare organizations. It could be from an EHR or from a backend service app, as we call it. On the left-hand side, you will see the provider who is actually performing various activities in their workflows, essentially, updating the charts and capturing all the data that is necessary on the patient. And once the data is updated into the EHR, there is going to be a lot of interaction between how to get the data out and make it available for public health. So there is a lot of notifications, queries, back and forth between the backend service app and the EHR to do that. Now, for the backend service app to actually, get the data from the EHR and then submit it to a public health agency in a generic way for multiple use cases, like Maria has been explaining, we need to come up with a set of architecture constructs that are generic in nature for multiple use cases. And we call that as the knowledge artifact. The knowledge artifact contains information such as, what value sets we need to use, what timing constraints we need to honor, what are the types of input and output data that we need to produce, what are the types of events that we need to subscribe to for notifications. All of those things are contained in what is called as a knowledge artifact. Those knowledge artifacts are present in a knowledge artifact repository. And typically the research organization or the public health agency would create those knowledge artifacts and then publish them. And then the backend service app or the EHR could pull down those knowledge artifacts, process them, and then based on the processing, they would infer what data they need to collect from the EHR, and then create the data. I mean, create the queries, pull the data, and then assemble the data into a bundle, and then typically submit it. Now, for research purposes, sometimes you want to de-identify or anonymize or pseudonymize the data. So there is an actor called as a data/trust services provider. So that particular actor provides about 5 to 6 operations which basically manipulate the data. So anonymize is one operation, pseudonymize is another operation, de-identify, re-identify, hashing, and linking. So those are all operations that are provided by the data or trust service providers, which basically take a bundle and operate on the bundle and give back, a masked bundle, if you will. Then the trusted third party, like I said, would be used as an intermediary to route information from the healthcare organization all the way to the public health agency or the research organization. So these are kind of the top level actors that we have. And there is a lot of arrows going back and forth here. Instead of spending too much on this diagram, we'll go to the next slide and we'll kind of go through each particular interaction in more detail to kind of explain how things work. So we call these as workflows. Each of these interactions, we call them as workflows. One of the first workflow is what is called as the provisioning workflow. The provisioning workflow is essentially, trying to get the system ready for all these interactions to happen. So this particular workflow deals with creation of the knowledge artifacts in the knowledge artifact repository. So the public health agency or the research organization in step P1 would create a knowledge artifact which would contain all the information that is necessary for automatically processing the knowledge artifact and inferring what needs to happen in the workflow. So that is published into the knowledge artifact repository. It's essentially a bundle which contains the plan definition resource, a value set resource, library resources, and a few other resources that might be necessary. So all of that is kind of contained in that bundle, and that is deposited into the knowledge artifact repository in step P1. In step P2, essentially the backend service app either gets notified or it would query the knowledge artifact repository for the specific artifacts that it is interested in, and then it would automatically process that knowledge artifact. And once it processes the knowledge artifact, it would basically identify a list of all the subscription topics or subscriptions that it needs to register with the EHR. So in step P4, after the knowledge artifact is processed, it would basically register with the EHR for a list of subscription topics in the current model. Once it registers with the subscription, with the EHR for the subscription topics, eventually it would get notified, which is how the whole thing is supposed to work. The reason why we call it as a backend service app is because there is no real human involved here. The app would basically download and then, process it and then register it. And when it gets notified, it would automatically pull out the data. There could be a healthcare organization's approval before any knowledge artifact is operationalized. So there could be policies which would basically prevent a backend service app from directly taking a knowledge artifact and doing some queries or doing anything like that. So that is more of an operationalization consideration that can happen. Once the healthcare organization has blessed that these are 2 or 3 or 5 or 10 knowledge artifacts that we need to support, then the backend service app can do that automatically. So that's the provisioning workflow. If you go to the next one. So in the Connectathon, for the provisioning workflows, we have demonstrated previously how to create a knowledge artifact. We can basically use a postman and deposit that knowledge artifact. And essentially, we basically use that. It's a fire server which can process a bundle and create all the component resources. So we have used the electronic case reporting implementation guide and some of the examples from that. We have used the MedMorph implementation guide and examples from that. So we have done this a couple of times now in different Connectathons. So if you go to the next one. So this is again retrieval. Retrieval is a simple get API. So all of this is information is in the implementation guide itself. There is capability statements for each of the actors and the APIs that need to be supported. So, the backend service app or the EHR basically can retrieve a knowledge artifact by name, by publisher, by title, by version number, or by a combination of multiple search parameters. So once that is retrieved, then it would process that. So these are Connectathon specific things that we have done previously where we have demonstrated how to retrieve a knowledge artifact. If you go to the next slide. So the next workflow is, now that you have processed a knowledge artifact and registered for subscriptions in the EHR, you would get a notification. So this is called as a notification workflow. Typically, the notification would happen because something happened in the EHR. Maybe a provider updated the data of a particular patient. So when the data gets updated, if that data changes, is something that you have subscribed to, like for example, the closing of an encounter or addition of a new diagnosis code or changing in a medication. Those are all different types of events that can happen. So when any of those things happen, the EHR would notify the backend service app for the topics that it was registered in. And once it gets notified, then in step N3, the backend service app goes back and queries for the patient record using the appropriate FHIR APIs. And then it starts evaluating if something needs to be reported or something needs to be done per the knowledge artifact workflow. So for example, in electronic case reporting, we would check a set of value sets to see if any of the diagnosis conditions, for example, are in a particular value set, or medications are in a particular value sets, or there is a lab result which is important for the specific condition. Similarly, for healthcare surveys, we would be looking at if the provider is participating in a healthcare survey, and if so, then we would report it. Or for cancer, again, if there is a specific diagnosis or a lab result that is indicative of a tumor, then we would basically say, yeah, we need to do something about it. So in step N3 and N4, essentially you're querying and getting data, and N5 is basically the processing to understand if something needs to be done further. So this notification workflow is essentially all about receiving the notifications from the EHR and then processing the notification and getting the preparing to execute the next step. So if you go to the next one slide. So these are again things that we tried to do in the Connectathons previously. So we have basically tried to create subscription topics on the EHR, but we have not been very successful yet because there's not a lot of EHRs that are supporting subscriptions as of yet. So we had to do certain workarounds for that, and basically kind of work around the fact that the subscription mechanism is not there. So we had to keep track of what data we need to collect independently. And when we get some kind of trigger, we would go back and query the EHR and figure out what the data is. So this is essentially, something that we have done previously in previous Connectathons. If you go to the next slide. This is for the notification itself, because the EHRs are currently not yet at the point where subscriptions are supported widely. So what we did is essentially try to create a RESTful API that can be invoked by kind of a stub or a program. And once that API is invoked, that is kind of like a notification. And based on that invocation, then we would go back and query the EHR and get all the other data. So we kind of simulated the notification workflow, if you will, just like as if it would come from an EHR. So we launched the notification workflow with basically the patient ID and the encounter ID as the context. And then based on those, we would go back and get all the data. Okay, so if you go to the next slide. So now that the notification is done, the next workflow is essentially the creation of the report. Again, assembling the report with all the data that is necessary. So what you will see is a set of queries by the backend service app into the EHR in step D2 and get the data back in D3. that is all a result of the step D1, which was the notification. So D1 is where we get the notification. D2 and D3 basically show the data queries and the data coming back. Once we get the data in step D4, essentially process the data from the EHR, applying necessary filters and logic. For example, we might have to report only certain types of data. Certain type of data may not be required. So for example, we might only have to report like problem list, maybe items, not encounter diagnosis, or we might have to do report on only observations for travel history in for COVID purposes, but maybe not lab results. So there will be a lot of filtering that happens on the data itself in step D4 to kind of subset the data that we have received from the EHR. Once we do the filtering, then we check with the knowledge artifact to see if any of the data or the trust services have to be invoked. And if they have to be invoked, then we would invoke that and we get back a bundle which has some kind of operation performed on it, which could be de-identification, anonymization, pseudonymization, etc. And once the data comes back, then the backend service app finally assembles the final report and gets it ready for submission. So that's essentially the report creation workflow. If you go to the next slide. So we tested this quite a few times in our previous Connectathons, where based on the notification, we would go back and retrieve a lot of the US core resources, which is widely supported in the EHRs. We used the open sandboxes for testing, where we had specific patients that we had set up with specific data elements. So using that, we kind of tested that we can create a report and we can assemble a report with a bunch of data elements, and then process the returned data from the EHR and filter it and all of that kind of stuff. So previously we have used like the Cerner sandbox, where we had set up some test patients for cancer and some test patients for some other use cases, and that is essentially what we use to retrieve the data and then filter the data and essentially use that to create the report. Okay, if you go to the next slide. This is essentially the report submission workflow. Once the report has been created, now you're trying to submit it. So you're trying to submit from the healthcare organization side through the PHA or the research organization directly, or through a trusted third party. So this workflow is basically showing those different steps. Sometimes it goes through a trusted third party and then ends up in the public health organization, or sometimes it will directly go to the public health agency or the research organization. So this is mostly just a routing function where the knowledge artifact would basically indicate the receiver endpoint, and we would basically invoke that endpoint and submit the data. Okay, if you go to the next one. Yeah, we have tested this a few times. We have tested with both directly and through an intermediary, thanks to some of our eHealth Exchange testing partners who acted as the trusted third party in submitting the data to the PHA. And so we have tested both the direct connection and with the PHA. Basically, we're submitting a bundle with a bunch of resources with a message header resource, which kind of indicates the source and the destination of the bundle and what it contains. So again, we leveraged most of the test data that we created in the sandboxes, and we created and we tested with those. So if you go to the next one. So this is the same one, except that we are sending the data directly to the PHA. If you go to the next. So the next one is the receiving response. Essentially, once the PHA or the research organization gets the data and processes the data, they could basically send a response back to the healthcare organization. So this workflow is basically depicting how that would work. So the PHA or the research organization would create the response that needs to be submitted back. And there are two paths, one through the trusted third party and one directly to the healthcare organization. So that's what's shown here in the diagram in steps R2, which is either going to the TTP or the healthcare organization directly. In the case of TTP, then the TTP would route it back to the backend service app in step R3. And then R4 and R5 is once the response is received, if anything is required to be re-identified, that would be done. If not, they would be skipped. And then we would deposit the data back into the EHR as some kind of a document reference or a communication type of a resource. So that's the receiving response workflow. If you go to the next slide, we have done some limited testing on this previously, where we have got taken a response and submitted from to the TTP, and the TTP sends it to the backend service app and verified that we were able to receive it. So again, we use some of the test bundles that we have created in the ECR and the MedMorph implementation guides. If you go to the next slide. Instead of a push from the public health agency or a research organization in terms of the response, the other option that we have outlined in the architecture is a pull mechanism, where the healthcare organization can pull the responses that is applicable to itself from the public health agency or the research organization. So again, that is something that we have outlined in the architecture. We have not done a lot of testing. This would be a get from the healthcare organization, which is the backend service app, just like other gets that it would do, and then get the data that it needs. So we have not done any testing on this particular workflow. If you go to the next one. So that's essentially all the different workflows that we have outlined from the public health reporting standpoint. There's a few other workflows related to research that we didn't cover in this Connectathon, that are also part of the implementation guide, so people can read about that. So in terms of previous Connectathons, we started doing our Connectathons for the first one in November 2021. We had a number of actors represented in the Connectathon by a number of, thanks to a number of people on this call and agencies who participated. Most of the activity was, initially some demonstration and then followed up by some testing. So we demonstrated and tested the provisioning workflow, the report creation, and the report submission workflows. We did identify a number of items that we wanted to add to the IG to help the implementation people. So based off of that Connectathon, we added a bunch of things and made the IG a little better. We added a bunch of examples that came out of the Connectathon. We set up a Zulip channel for discussion. We also set up EHR sandboxes with test data that would be necessary for testing, the MedMorph reference architecture. So all of that was done. And then we started discussing about subscription topics and how to get that in front of the EHR vendors, and maybe harmonizing with other initiatives and so on and so forth. So all of that, were things that we kind of performed and took notes and, made more changes to the implementation guide to help further the implementation guide, the reference architecture. If you go to the next slide. There was a lot of lessons learned, specifically about search parameters, the types of support, whether JSON and XML are both required or one or the other. And then, how do the bundles kind of stitch together? We also talked about how do we specify groups for healthcare service use cases. We talked about action codes. Action codes are essentially things that happen in the workflow, like, invoking a notification or invoking a creation of a report or de-identifying data. Those are all actions. So we needed to fix some of those profiles to contain the right IDs. We had to fix context parameters, value sets. So we added a lot of information coming out of the Connectathon into the IG to help the IG make a little better based on all the things that we encountered at the Connectathon. So then I think, we also talked about how to reduce the EHR burden by streamlining the queries and the events. So again, those are all things that are documented in the IG. So if you go to the next slide. So we added a number of these queries for subscriptions initially, but now, now that we are here, the subscription backport initiative started up in parallel, and we're planning to migrate to the subscription backport IG instead of using the old subscription model. So we will be making MedMorph reference architecture compatible with the subscription backport implementation guide, and create subscription topics and stuff like that. We also emphasize the process message endpoint, for submitting the bundles, because we are submitting messages back and forth between healthcare organizations and public health organizations. So the message header will contain a lot of the metadata that is necessary to be sent back and forth. then we also discussed whether we should, notify clinical care organizations of changes to knowledge artifact through subscriptions or other mechanisms. So, there's still discussion ongoing on some of those things. We discussed about push and pull preferences on receiving the responses, so that we can understand from a security standpoint the overhead on an intermediary to do some of the work that is necessary. And then we also discussed about the lack of context sometimes, like we might have a patient ID context, but we may not have an encounter context. So how do we handle those? And what we need to do, whether we need to time bound the resources, because some patients may have a large amount of data in the EHR, and we don't want to create reports using all of the data that is out there and then send it out. So how do we subset the data and so on and so forth. So there are some concepts that we have come up with. Again, these things will evolve as we do more implementation and piloting. So if you go to the next slide. Then the next Connectathon was in the January 2021 as part of the HL7. So what we did there is, because at that point we had finished, our IG was in ballot, and we wanted to review the detailed implementation guide that had been balloted. So we spent a lot of time and walked through the whole MedMorph IG and all portions of the IG in more detail for all the implementation people. And we discussed every single aspect, including knowledge artifact creation, EHR notifications, triggers, fire messaging, and then we did some testing activities to demonstrate, how we could do some of the automatic generation of reports and submission of reports. So all of that was kind of accomplished at a high level in the January Connectathon. If you go to the next slide, I think. And again, for lessons learned, because the MedMorph implementation guide is a reference architecture implementation guide, and we have been talking about content implementation guides for the 3 use cases that we have. We needed to add more guidance in the reference architecture implementation guide on, what is content implementation guides, how it will be created, and how would plan definitions become a computable resource instance, so that backend service app can process it automatically and do the actions that it's necessary. We discussed about profiles and how do we specify the inputs and outputs to the profiles, groups, and how do we map the groups between different organizations, so on and so forth. Also, we talked about identification of the queries and the data elements that we need to identify in the content IG, and how they're mapped to US CDI, so that we know that they're widely available. And then definitely the subscription topics and synchronizing that with EHR vendors is essentially a big thing that we are going to be working going forward. And then messaging, we talked about fire messaging and also writing back into the EHR using document reference as an option. Initially, we had just specified communication resource, but now, after further evaluation, document reference is also something that we need. And then, we need to make response codes a little more generic for MedMorph use cases, so that they're more broadly applicable across multiple use cases. So these were all things that we learned from the January Connectathon. If we go to the next slide. So all of this was entered into the Jira for MedMorph, and we're starting to basically work through the comments, ballot comments, and disposition them, and eventually we'll be making further updates. So we'll be doing more Connectathons as we go forward. So that's the technical part. So I'll send it back to Maria to finish up some of the other slides.
Thank you, Dragan. So I'm going to wrap us up with some of the next steps of what's to come in the rest of 2021. So here is kind of our tentative timeline. We are, just for reference, right about here in the middle of the IHE Connectathon, which we consider one of our MedMorph project activities. Those are listed in sort of a peach color, and then HL7 processes are in blue. So we're in the process of developing those use case content IGs that Dragan was just mentioning, and in the process of also dispositioning our ballot comments. We will also be starting a real world pilot soon. We hope to kick off, in fact, towards the end of the month. And then there's a whole bunch of different requirements related to ultimately submitting those content IGs for ballot in September. and preparing for both the May and September work group meetings and Connectathons. We also are looking to participate in the HIMSS Interoperability Showcase. Once we start incorporating input from our various Connectathons and through the development of our content IGs, we plan to update our reference architecture implementation guide and republish it. And hopefully by the end of the year, we'll be pretty close to completing our real world test pilots. And then in our different work groups, our reference architecture work group will be kind of the primary point group for working with the public health work group to complete our ballot reconciliation and support additional use cases and submit JIRA trackers as needed. Our use case work group will be the primary point on developing those use case content implementation guides, or at least the requirements for them, and working with the reference architecture work group to make sure that elements of the reference architecture get updated as needed. And then preparing and submitting comments on the draft USCDI version 2. We will also, like I mentioned, have real world pilot testing in parallel that will help also inform our reference architecture. And our evaluation work group will be the point on the short-term evaluation that will be part of the real world pilot. And they'll also be developing our long-term evaluation plan that will be incorporated into the roadmap. So this project is not just me and Dragon. Here is the rest of the MedMorph team and our email addresses. This really has been a pretty big group effort. And I should also say our technical expert panel members have also been very key. So I'd like to thank all of them for their help and input throughout this past year or so as we've been working to get to this point, and look forward to continuing our work into the next year and beyond. A few resources here that you might want to take a look at are reference architecture IG, our Connectathon Confluence page, another Confluence page that has some public information available, and then a CDC page that's got kind of an overview of MedMorph. So I'm going to pause here and see if there are any questions.
I have many questions. I just don't know when I should bring them up. This is John Murky.
Go ahead.
So this is the first time I've really been able to get a full perspective. And I guess I'm coming at this from the perspective of how can IHE Connectathon help as this matures beyond what is typically done at a fire Connectathon. So I'm looking at this as what of this, because there's a lot of this, what of this is approaching the kind of maturity that would require or benefit by the creation of a set test plan, test procedures, test bench, test results, publications, those kinds of things. And what parts of it are so immature so as to continue to develop. And I kind of heard and agree with Dragon's point around subscription. That seems like something that is going to take some more development, but just kind of from a 10,000 foot level, or 30,000 or 100,000. What's kind of the vision from the perspective of when is each one of these things likely to fall into the categories of A, we're just using that interaction is already designed in a different implementation guide. We're just going to take the results of that implementation guide and just say, yep, that's good enough. B, it falls into the camp of this is special for MedMorph, and it's mature enough that we should be creating a test plan and test procedures and a bench tooling and the like, versus the potential other category. Maybe there's other categories as well, but that is kind of my thinking as you two were going through this. Reactions?
Well, maybe I'll ask Dragon to react first on some of the technical questions you asked. Dragon?
Yeah, I think, we are still trying to figure that out, John, to be honest. I mean, of course, the strength of IHE is all the participants that, come to the table with, especially the EHR vendors and all the other participants with actual systems where we can definitely see if we can, test out a bunch of things. That's a big bonus. But also, since it's heavily focused on fire, it's been a while since I've paid attention to some of the developments in IHE Connectathons with respect to fire. So I think this is probably an opening for us to kind of understand what can be done and how it can be done.
Sure.
What kind of things.
Let me fill you in there, because IHE has 35 profiles today that are using fire. So IHE Connectathon is not devoid of fire. Fact is, it's dominant thing that's being tested. The main difference between a fire connectathon and an IHE connectathon is the maturity of the testing expectations. So we have when we have a implementation guide to test, we go formally through registration of actors to be tested. There would be a test plan written up for what they have to prove before they can even show up on day one. There is along with that test plan and procedures are the selection and configuration of test tooling. We're leveraging the Inferno test platform. For that, we're leveraging some other components from the Happy Toolkit and for other places. So we do a lot of fire testing. I mean, this is not a world devoid of fire.
That's very good to know, John. I think so. In one of the previous slides, I think Maria had pointed out, some of the vision in terms of certification and testing as we go further in the life cycle. I think, that kind of formal testing would be definitely something that would be required when, as the artifacts mature, for sure.
Yeah. Hey, this is Amit. I just wanted to pop in and add a comment. This track was set up so we could start this dialogue between IHE and the MedMorph team in greater detail too. So appreciate your questions. And I think that there's an opportunity to dig into this deeper too, because as you can tell, this is a fairly complex undertaking, lots of moving parts. And so I think we have an opportunity to look at what's been done so far, what we may have available in the current testing schemes that we have, and then also looking at some of the other projects that are going on within QUIRF, IHE QUIRF, and other communities as well. So really appreciate the fact that the MedMorph team is here. Also very excited to bring some of our IHE SMEs here to take a look at what's going on and see how we can help, how we can all work together and figure out better ways to move things forward. So.
Yeah, and I think one of the things I'll add is, as I mentioned earlier, we're planning to hopefully soon kick off a real world test pilot. And through that, I think we'll also learn a lot more about what could ultimately go into things like testing scenarios and testing plans. So I think we're just at the beginning of all of the opportunities that Amit just mentioned to really help plan this out and work together with IHE to develop all of these different aspects that can help ultimately going forward with conformance testing. Okay, any other questions?
Well, yeah, I think I just want to gambit off of that. So if there is a plan around, moving from experimental, testing of the spec to formal testing of, I'll say products, but solutions that have implemented the spec. I think that's absolutely where we want to hook in first, because it's at that point that we can bring to bear the governance of the IHE Connectathon, work through the creation of the test plan, work through the creation of the test procedures, selection of test tools, configuration of test tools, and the like. It doesn't mean that we're not engaged, further upstream. I think there's another discussion we can have around to what extent can we bring to bear the IHE governance and/or existing set of profiles to aid with the development of this or the like. And that just wasn't as clear to me. Oh, here's a place. So it doesn't mean there isn't an opportunity, but I just don't want to say that there isn't an opportunity there as well.
Well, one thought I had is perhaps we can have you guys present to our TEP at one of our upcoming monthly meetings, so that we can really start thinking about all of this and working with you. And we can also set up some sort of regular cadence of meetings with you guys to discuss further details. That might be kind of a good overview, especially for some of our TEP members that may also not be so familiar with IHE. That way we can really get all of them helping us think about this and working with you.
Yeah, I think the sweet spot is that tipping point, but certainly there's some other places.
Okay.
And Maria, I was just looking at the chat, and there's a question from Michelle at MITRE. Is there any further information on the real-world test pilot, or is that under development?
It's under development. We're currently in negotiations with some potential pilot sites, so I can't really say much more other than our hope is that we'll be able to kick off towards the end of March. So I should be able to provide more information at that time and be able to give more detail on things like who the sites are and that sort of thing. What I will say in our kind of request for proposal on that, what we requested was 3 different sites. And when I say different sites, different types of sites, so that we don't, for example, end up with all academic medical centers. So we're specifically looking for sites in particular for some of the more underserved communities, so that we can make sure that we can take their challenges into account. We are looking for each of those 3 sites to have different EHR platforms. So that way, when we say that this should be able to work across EHR platforms, we would have tested it in the real world. And we're also looking to have at least 1 public health agency and 1 research organization to serve on the receiving side of the messages. So that's about as much as I can explain at this point, but we will be sharing more information as we're able to.
Maria, this is Michelle. Thank you. A follow-on question to that is, are all your use cases going to be tested in this real world test pilot, or just 1?
We're starting with the hepatitis C use case because we essentially have a content implementation guide for that. And then we are potentially going to be testing the others as well. Right now, though, we don't have concrete plans for those.
Thank you.
Any last questions before we start to switch over to the testing portion of our session?
I have a potentially very different question to ask. And you can tell me this is something for later or a different place. IHE is well known for our set of document sharing exchange profiles, XDS, XCA, MHD now. And I can't help but look at your overall architecture and wonder if the fundamentals of your plan definitions, your patterns, I forget what you call them, and the results. It seems like that could be just as well communicated through that kind of an exchange. It might not be, using fire subscription. It might not be using resource by resource queries, but it looks like what is registered into the system is, hey, I want this kind of data. A organization ultimately says, oh, hey, I can get you that kind of data, and here's a report of that kind of data. And that sounds to me like fundamentally could be done over an exchange architecture, therefore, in the USA, over the networks like eHealth Exchange, Care Quality, Commonwealth, rather than focusing this on only everybody picking up a totally new exchange architecture in order to serve a use case. Has that been looked at? If not, is it an interesting concept? If so, when could I, help figure out, whether that would fit? Because it sure looks like it should be able to.
So I'll just kind of answer in short and maybe ask Dragon to jump in with anything else. But I don't think we've looked at that. But we would be interested in maybe talking with you perhaps at one of our team meetings and trying to see what might work with that. So I mean, Dragon, have you looked into anything that John just mentioned?
No, no, definitely not. So I think, yeah, it would be worth a discussion and,
Well,
And I was going to say, especially as some of these profiles, we're developing them and we're hoping there'll be more adoption and implementation, right? And so it's a orchestration, right, around trying to make sure that there's awareness, trying to get people to understand the full concepts, things like that. But I think there may be an opportunity here, like Maria that you mentioned, presenting to the TEP. I know we're in IHE, we're going to be doing a lot of work around promoting these new document sharing paradigms because I think just the word hasn't quite gotten out yet. And so I look at it as all good opportunities to bring this work together. There was also another question from Alex around where can we find information about the other use cases than hepatitis?
So some of the information is in the modeling that we've done so far, since we are in the process of developing the content implementation guides. We're actually working on including some of that information in the reference architecture IG. I don't believe it's in there yet, but we are working on providing a little bit more detail using those as examples in the reference architecture IG. And then as we have information in content implementation guides, we can share those links. Right now, we don't have that yet. So that way you can take a look at more of the detail as it's being developed. Anything to add, Dragon?
no, nothing else, Maria, I think, yeah.
Okay. Thanks, Alex.
Just to skip back to the thing I was bringing up. One of the misunderstandings that I am pushing to get clarity on is many people think that the document sharing that IHE has, XDS, XCA, are capital D documents, as in they have to be CDA documents. They don't even have to be FHIR documents. It is a lowercase d, as in the same lowercase document definition that HTTP is based on. So when you do an HTTP GET request, you get a document. So, one of the things that I'm leveraging when I say, gosh, it looks like your overall architecture could work with document sharing, is to recognize that they don't have to be formal fire documents or CDA documents. They can simply be a care plan, or what was your the main resource you use for artifact?
Knowledge artifact.
What was it?
Knowledge artifact.
Yeah, so I mean, you can push a knowledge artifact as if it was a lowercase d document in this exchange, and you could pull a search set bundle or a bulk data bundle, or so just mindset wise, I don't want the existing architectures that are doing billions of transactions a month to be ignored because people think they can only communicate CDA. So let's cue that up for some future discussion.
Yeah, I think that would be a good next discussion with our team, and maybe leading to including some of that in a presentation to our TEP. So I think that would be helpful, in addition to having kind of more of the overview, kind of showing exactly what you described, would be really helpful for all of our TEP members to also hear. So yeah, let's definitely touch base after this and work through how exactly we can take the next steps to lead us to what we've just been discussing. All right, any last questions before we switch over to testing mode?
Well, I'm noticing a question to me from Alex. Document reference in FHIR is also lowercase d document. Document reference very explicitly in the definition of the resource explains that it's any form of bucket of bits that has a MIME type. So it's only capital D document because FHIR uses Pascal case for the resource names. Did that answer your question, Alex?
Yeah, that did, but I find that really confusing because we're talking about a document reference which is structured and written in the resource page around containing any kind of FHIR document, containing CEDA documents, containing PDFs. So I'm just wondering if there's a way to make that a little bit clearer. And then MHD also contains IHE specific profiles for those documents. And it's really not clear that it's this lowercase d document, but that makes sense, especially given MHDS.
Yeah, okay.
Yeah, I mean, I just think it's something that maybe IHE needs to clarify, especially in MHDS, because the way that MHDS is set up is really good for how to bridge a number of disparate FHIR profiles in IHE.
Thanks.
Yeah.
All right, thanks, Alex and John. Anything else? Okay, well, thank you all for listening in on our presentation and asking some really good questions. And shortly, I'm going to turn it over to Dragon here so that we can start the testing portion of this MedMorph session. So again, thank you all.
Okay, are we starting now, I guess?
Yes, go ahead.
So I am not sure who's all here. I know we're definitely looking to see if Paul is here on the call from University of Washington.
Yes, I am present.
Hey, Paul, how are you?
Oh, good,
And
thank you.
Yeah, and I think I don't know if Jacob is here from Epic. Right. We would need Jacob, right?
I think so. Do we need to ping him?
Yeah, I think so.
All right. I don't know if he's got this link. I didn't have it on mine either.
Okay, so
And folks, this is Amit. So I was going to say, let me know how I can help if need be. We have the Slack channels. If there's folks in Connectathon
Yeah,
main floor.
that would be really helpful. I'm getting ready to jump on the IIP, but yeah, Jacob, I think, is really our first point of contact, and Danielle is on the fire, and I think our point of contact.
Great. So feel free to chat me, Slack me, and I can see if we can make any of those, I can ping some of those folks if they're on the other testing floor, or if
Yeah, I
they
think we
need to
can-
be given access to the session too, I'll work with my team to make sure that they get that.
I think we need to get them this link so that they know to join.
Cool.
so Paul, were you able to successfully get the A08s finally, or is that still pending? Or
Yes, that was coming through yesterday. I do, in fact, have. If we can't get Jacob here, what we, I don't know if you want to fake this or not, but I can replay a message he sent to me as if it just came in and pass that on to your API.
okay, so definitely we can do that. I mean, the only reason I'm looking for Jacob is even if you notify me, I wouldn't be able to do anything with it unless the authorization authentication works on the other side.
Correct.
So,
yeah, that's what it looked like from the email thread. I'm
so-
following you.
Yeah, which is why I was looking for Jacob, so that we can make sure that I did try with the client ID, but the HTTPS connection, the certificate looks like it's an invalid certificate on the server, on the Epic server. So the Ssl handshake is failing at the connection layer. So either it has to be an open end. I mean, we have to go to a HTTP only endpoint and see if it works. So that's the reason why I'm calling. So maybe what we can do is, if you want to hit the notify API once now, you can hit that.
Okay,
and
sure.
see what the result is, and I will also start logging into my server and try to see if I can bring up the log files.
Okay, so what I'll do is I'll replay this one message picked up yesterday. This is an ADT A08. Three, two, one.
I mean, the reason you are getting bad request is because we were trying to get the authentication done, and that was not working on the other side. So
Right. So it does look like identical results.
okay.
I don't know if you have logs you can view there to see if
Yeah,
you're
I'm
able to.
I'm logging into my servers now.
Okay.
I'm getting a JSON default handler exception, JSON parse error. That looks different than what I used to get. Can you paste the request that you sent, Paul, like in the chat window or something?
You know, I didn't capture that. I can modify the channel and try and capture that. One thing that, you know, yesterday we were talking about, I did put the event type back in there.
Yeah, that's fine. Event type
but
is okay.
It should all be valid JSON.
So you're sending it from the program directly? There's no way for you to. It's
Well,
not from the-
I'm not going to say there's no way. What I'm going to do right now is modify this channel so I can log the entire thing.
Yeah, if you can just send me the payload.
Right. Yeah, it is built up right there. So I might have to move some things around to log that accurately. Let's do this.
Okay. So for people on the phone, you know, I just wanted to make sure that you guys know what the expectation is. We are planning to go completely tech detailed and do testing. So the discussion will be centered around JSONs and APIs and failures and successes and things like that. I'm not sure how many of you will be able to follow versus not follow, but if you have any specific questions, you know, feel free to ask us and we'll be able to respond.
Dragon, I have a question. This is Alex.
Yeah, Alex. Hi, Alex.
Hi. Jamie sent out an email on Monday with the confirmed testing partners.
Yep.
And it's listed everybody who's participating, but I don't have everyone's endpoints.
Okay. So which particular endpoint would you need, Alex? The PHA or the EHR, or we can ask, you know, all the other people on the call and directly exchange it, whatever is required.
Well, I mean, I'm just thinking about the EHR applications. Do we all have Tim's endpoint and then Mike's trusted third party as well?
Yeah, Mike is also on the call. I think he was on the call.
Maybe we could put them in the chat when people have a minute.
Yeah,
Or
I
in
think
the
we'll just
Slack.
do that right now. You want to do it? You want me to put it on? I'll put it on chat and then later on I'll put it on the Slack also.
Sure.
So, okay, I think Jacob joined us, right?
Yep, I'm here.
Hey, Jacob, how are you?
Doing well.
Okay, Jacob, there are two things that we wanted to make sure. So I'm trying to hit the EHR to get authorized using the Smart on Fire backend implementation. So you sent me a client ID that you or Aaron, one of you sent me a client ID. So that client ID should work, right?
To the best of my knowledge, yes.
Okay. The issue that we're having right now when we try to get authorized is an Ssl handshake exception on the server. And looks like the certificate that is being used for the HTTPS connection is invalid. Is there a HTTP endpoint that we could hit to see if that can be eliminated?
I'm not sure. Let me see if Aaron or Danielle is able to jump on. One moment. Looks like Danielle will be on in the next 5 to 10 minutes.
Thanks, Jacob.
Hi, Jake and Paul again. You asked me for, a simple request to present to you the JSON I'm posting from within this interface engine. Unless I move things around a fair amount, it's somewhat difficult for me to capture that. Like, it'd be easier for me to stand up my own service and catch it.
No, that's all
possible?
right, Paul. I can log it on my side. Not a
Okay,
problem.
great. Thank you. I thought that might be easier.
The event type that you're sending is a capital E or a small e?
I followed the template you sent me. It is the one with a capital. That's very easy to change. You want to go to lowercase e, capital T?
Yeah, I just want to make sure that we have the parameters. I'll just put the parameters for notification.
Right. I like that consistency. I was going to ask about that.
Yeah, so notification. Hold on. I'll put it on the chat window here in a minute.
Yeah. Would you like another send?
Not yet, not
Okay,
yet. I am
okay.
checking a few other things here to make sure everything is good. So let me do that.
It would probably help for me to paste in the template of more or less what this looks like. Some of the variables aren't filled in for you, but do you want that just here in the everyone chat or send that directly to you?
Either way is fine. I mean, you can put it here. I mean, we can use this chat. I mean, the whole thing is Connectathon anyway, so
Sure.
let's use it. Okay.
That'll at least give you the case and other things are the keys you're looking for.
Yeah. Okay, I think okay, that matches what we have.
I did just lowercase that event type. That was capital E before.
Oh, okay, hold on. Yeah. We have the fire server URL. The URL is caps on our side, so probably I need to check that.
Okay, happy to correct it here if you want.
No, I'll just make a change here. Go ahead, make a change. Maybe you're, it's faster for you.
Okay, so just the F or the whole word fire?
No. Let me give you the parameter. Fire server. So that's the parameter. Everything
Yeah.
else,
Okay, great.
everything else looks like they're matching up. Type message.
Okay. So here's the update.
Okay, you want to hit it and see what happens?
All right.
Yeah. Oops.
Okay, you say you're ready?
Yeah, go ahead.
Okay. Okay. Still seeing, yeah, the error. I don't have any more information on my end than the 400. Maybe you have something.
Okay. Yeah, let me check on my side now.
I can relatively easy dump out each variable in turn there, if that would help.
And it does look like Danielle has joined if you want to ask questions about the fire endpoint now.
Hello. Thanks, Jacob, for forwarding the meeting. We didn't have it.
No problem. Hey, thanks, Daniel, for joining. Hey, we are trying to hit the Epic endpoint.
Yeah.
We're getting an SSL connection error at the Ssl handshake.
Okay.
Looks like certificate issue on the HTTPS endpoint. Is there like an open?
Which endpoint are you hitting?
We are hitting the HTTPS ihe.epic.com interconnect-fire-open/API/fire/r4
Yep.
metadata.
That should be the certificate we're using is the IHE one. So if you have like the IHE CA certificate, that could work.
Is it looking for like a mutual TLS connection or something?
I believe so. So like I think you know, like if you're using Postman, you should be able to like click through and say ignore. Or if your system has the IG certificate in place, that should allow the traffic.
I see. Oh, okay. So we are not implementing mutual TLS on our side. So the application is just a program that is trying to just, we thought it was a one-way SSL connection.
Yeah,
So-
Dragon, this is Rob Dingwall. I don't think it's trying to do mutual TLS. What I think it's trying to do is verify the certificate, and the certificate is signed by IHE.
Right,
So
but
you don't have the IHE certificate authority, so it won't validate the certificate.
Right.
Depending on the language, there are ways to turn that off.
We're using Java, of course.
I'd have to look it up, but there is a command line argument that can go to the Java exec that will turn that sort of stuff off.
Oh, okay. We need to figure that out then, I guess. Let me find that. So that's interesting to see. Okay, that would be good. So we'll try that out, Daniel, in a few minutes. So maybe first try with a browser and try to override it and see if it works, and then or a Postman, and then we'll go from the other one.
Okay. Yeah, that sounds good. I can hang out on the call. What?
Yeah.
Okay, if you try from Postman, you should be able to get through, and that would let us make sure like your IP and stuff is appropriately allowed and all that.
Yeah, give me 5 minutes and
Yeah, no problem. Not to like put the pressure on. I can wait.
No.
Hey, Paul, this is Mike Yaskanis from eHealth Exchange. You still there?
This is Justin McReynolds, also at University of Washington with Paul. He had to step away for a minute.
Well,
But
I just had a question. He posted in chat a little piece of JSON that has a capability statement URL. Should that URL be accessible? Because I just tried through Postman and it just times out.
that's the IHEepic.com endpoint. I'd rather expect that it's not, but I defer to the Epic folks on that.
Mike, the metadata endpoint, that's what you're trying to hit?
Exactly, yeah.
Yeah, so that shouldn't require like any like setup or, client ID or anything like that. But it will require us to add your IP to the allow list. I don't know if we have yours in there. So we've just got some firewall rules on this IHE box for handling traffic.
Sure, no, that's fine. I just was testing it and it was timing out, so I didn't know if
yeah.
I was supposed to be able to hit it or not.
If you've got an IP address, I can get it added and you can test it if you'd like.
Alrighty. Well, no, it doesn't matter. It's really not that big of a deal. I just saw it there. I thought I'd check it out.
So Daniel, I'm able to get the metadata. So that's good. So the IP address is whitelisted. Now I will try to get the access token and see what happens. We're trying to bypass the SSL validation by using the JVM setting that Rob pointed out. So I put that in the chat window. We'll see if that works.
Awesome. And you're using the -OAuth endpoint then for the OAuth token and okay, cool.
Yeah, from the metadata, whatever
Perfect.
we get back from the metadata. So
yeah.
It'll be interesting to see how it works. Yeah, unfortunately, we have to go through our program. We don't have like a bypass for some of these things because the JWT, I don't have something that I can produce a JWT outside of the program. So that's the issue. Is there a patient ID and an encounter ID that I can use? Do you have?
Yeah.
If you can give us that patient ID and encounter ID, that would be good.
Yeah, let me see. I'm putting the fire ID, patient ID in the chat.
Yeah, if you can, thank you.
That's for Madeline. Patel.
Also, if you have an encounter ID, Daniel, if you could pop that in.
Yeah. All right, I put that in the chat.
Hi, Danielle, this is Paul.
Yeah.
I just noticed what you chatted there with regards to the patient ID and the encounter ID.
Yep.
I guess I just want to point out those are very different than the numbers I have from a test message that we're replaying from yesterday. That makes sense, but anyhow, Dragon, don't expect to see those same values in the packet I'm sending you.
Yeah, right now I'm just trying to use those values and see if I can get authorized with the EHR. So.
I see.
Hey, Lori or anyone on the call, do you guys have a copy of the IHE certificate that we can use so that we can bypass some of these things?
Hey, Dragon, let me check. Would you want me to get someone to send you a copy of the cert?
Yeah, or they could just paste it on the, yeah, that would be good. Then.
All right, hang on 1 second. We'll look into that.
Just want to make sure that that's not preventing us from testing it. Hey, give us some time. We're trying some code changes to see if we can bypass the Ssl handshake error. So,
Yeah, no problem.
yeah,
I will have to drop off at 10:30 and come back at 11 if that's all right with the group.
Yeah.
Be gone.
Yeah, that should be fine. Yeah, I think it'll take us 10-15 minutes anyway. So.
Okay, cool.
Daniel or Jacob, are you guys in there?
I'm here. I think Danielle had to drop for a while, as she mentioned.
Okay.
I did see your question. And
is that the right endpoint for the token URL? That's what's in the metadata that we're getting back.
yeah, I chatted Danielle your question on a different thread because she's not on the Zoom meeting anymore. And it looks like she's looking at it. So I'll let you know as soon as I get a response.
Okay, cool. Hey, Paul.
Yes.
You can try a curl command, right?
You'd like me to send you another? Is that what you're saying?
No, I'm pasting a curl command for the notify API.
Okay. Oh, curl command. Yes, I follow you.
Yeah. So if you want to give it a shot and see, so this is working with a different Epic instance. This is the Open Epic instance. So if you send this, you should get back some good response, hopefully.
Cool. Okay. So you'd like me to first just go ahead and run that command exactly as you have it.
Yeah, just want to make sure that it can work, make sure that you get back something reasonable. So then at least I know that the connectivity and all the other stuff is good.
Right. Can you not cut out of a chat window?
I don't know. I can send you an email.
Well,
you want me to do that?
It should work fine. I don't know why it's beeping at me. Yeah, there it is. Okay, I've sent that. It did not respond. Okay, notified successfully. There you go.
Okay, so at least we know that that connection works properly when everything is right.
Right. So let's see, what you've changed there is obviously a patient.
I gave you a different EHR URL, and the rest of it really doesn't matter because it's just going against EHR, the patient ID and counter ID and stuff. So
okay. And should we just for practice here go ahead and update the channel I have to make that same change?
No, not necessary. I mean, we could do that as a last thing. I would like to see if I can get the authorization token with the IHE instance.
Gotcha.
Because that, would be a big achievement for us.
Right.
So this one, we know if everything is right, it will work. So that's good. Let me then figure out the EDRS endpoint. I don't know if Eric is on.
Yes, I'm here.
Yeah, Eric, we tried to post a bundle to your endpoint. We got an exception when we do that. Do you want us to hit something and you want to monitor and see what is happening? So the endpoint that we're using is the one that the Connectathon Web API Fire R4 Death Medical.
Okay, let me check the log.
Mike, do you have like the process message endpoint, Mike? That's where we need to submit, or is it a regular endpoint?
You're asking Mike from eHealth Exchange?
Yeah, eHealth Exchange, Mike from eHealth Exchange.
Yeah, we're a pass-through. So if you submit a process message, we're going to pass it through to whatever the message header destination endpoint is. So we're really RESTful based pass-through. We're not going to attempt to interrogate the Fire payload.
So it's a post to the process message endpoint with the bundle.
Yes.
Okay. Let me see if we can send something to you while we're looking at this. Okay.
So Dragon, I see the request came in. And I see we routed it to 65, 61, 13, 216.
Yeah, we got a 405 back saying method not found.
Yep, that's we passed that back from the from your ultimate receiver, the target.
Oh, okay. Interesting. And you're calling process message on that endpoint also? Is that what you're trying to do?
We passed through the full URL, but let me take a look at the logs here.
I know Tim from California Cancer Registry put a URL in. Tim, are you there?
Hi, yes, I'm there. Can you hear me?
Yeah, we can. So Tim, we just wanted to check, do you support like a post with the bundle, or do you support like the process message endpoint?
We could try either one. I know we support the post. but maybe not the bundle that does the processing. I'm not sure.
Okay. We'll try one with yours endpoint
Okay.
and see what happens.
I will be, so you're posting a bundle?
Yeah, we will
Okay.
try to post. So we send it to eHealth Exchange and they will post a bundle to you. So
Sounds good.
I think we got the same response. Again, let me take a look at our logs to see what. And we're doing a post, and the response we're getting is HTTP verb used to access this page is not allowed.
that's interesting. Probably Eric can answer that. So one thing that we did do, Mike, is when we just post the data to the actual EDRS endpoint as in the chat window without doing anything. So the bundle is posted to that endpoint, we get a 200 back. So, but
Yep.
that's not, that's not really like the standard endpoint, right? The standard endpoint has to be the complete either bundle post or message header process message, things like that. So
Let me just so I understand. So if you post directly to
the 65, what is the endpoint? I forget. The 65 dot the whole thing directly to that endpoint.
it's successful, but when you go through our trusted third party, it's not.
Yeah, exactly.
Okay, all right. I'm taking a look at the logs then.
Yeah, just see what you're doing. Maybe you can try it out first to see if you can post it to the same endpoint and see if you get a successful, from command line or Postman or something.
Yeah, could you send me the endpoint that well, I can pull it up from the message. Hold on.
Yeah, you should be able to pull it from the message.
Dragon, I'm going to post in the chat. This is the target that we received.
That is right, Mike.
Okay.
I mean, I just did another message with the other endpoint. So we're checking that out.
Yep.
Okay. Hey, Mike, when we submitted to the California Cancer Registry, the same bundle through eHealth Exchange, that seemed to be created when we got a 201 back.
Yeah, I'm actually going to enable some enhanced HTTP tracing. Would you be able to resend the one that failed?
Yeah, sure.
And then perhaps immediately after resend the one that was successful, and I'll be able to compare.
Yeah, let me know when you're ready.
I'm ready.
Okay.
Hey there, this is Danielle. I'm back on. Jack, I think you had some testing questions.
Yeah, Daniel. So we tried to hit the token endpoint and get the access token. And we're getting a 404 endpoint not essentially not found.
Okay.
And posted on the chat window the URL that we're hitting and then the JWT that we're creating.
Do you mind reposting that? The chat's not there for me.
So I post the token URL first because it's a 404. Maybe the URL is not right. So
Yeah,
let me do that first, and then if you want to look at the JWT, I will post the JWT.
Cool.
So I just posted the token URL. Mike, you should have received two posts, Mike. One which failed, the 405, and the one which got successful, 201.
Got it. Thank you. I'm going to turn my trace off now and take a look.
So Tim, we were able to post to your endpoint. So I don't know if you want to check your system and see, what
Yeah,
you
I can
did
go
with
ahead.
it.
I can go and check. Thanks, Dragon. I'll post the some results in the chat
Yeah, no problem.
or the Slack.
Yeah. So Eric, we still haven't been able to successfully hit your endpoint yet. So we need to figure that out, what's going on. And Alex, I know you were trying to test some stuff. Have you been able to hit anything as of yet?
Can you guys resend to us?
No, we haven't sent anything to you. So I wanted to check to see.
No, this is Eric. Sorry.
Yeah, Alex, yeah. Oh, Eric, sorry. Eric, yeah, we tried to send
Can you
stuff to
resend?
you. You want us to resend again?
Yes.
Okay, yeah, give us 1 second. Eric, can you check if you got the message? Let us know if you see the message at all, first of all.
Dragon, this is Mike.
Yeah, Mike. Hey,
Can
Mike.
you, I'm digging into this. I'm wondering if I've got an issue with app paths concatenation, but could you provide me with the direct URL that you invoke for both of those two tests?
Yeah, sure.
And the first one, the one that fails, what is that? I mean, who is
That's
that?
the 65.61 that's on the
Yeah.
chat window. right now. That's the full URL.
Of who though? Who's the server is that?
That is Eric's server, EDRS, death reporting system.
Okay.
And then the other one that succeeded is I'll post the endpoint on that. That is the one from Tim. For
California Cancer Registry. Okay.
Yeah, those are the two endpoints.
But I'm just curious to know, like, what are you putting after these URLs? Is it just /bundle?
So Mike, for the 65.61 URL, we are sending it as it is without adding anything. Okay.
Okay.
For the California Cancel Registry, we are adding a /bundle at the end. I think Tim posted with the
There we go.
/bundle.
Yeah. Thank you. Are there any allow lists in place that would block me from hitting the EDRS endpoint directly from like Postman?
I'm not sure. Eric,
try.
can you talk about that?
No, we don't block anyone.
Okay, thanks.
But it looks like we had not received anything.
Is that the actual endpoint, Eric, or do we need to add like bundle or something at the end? Or
No, it's the actual endpoint.
Yeah, when I attempt to hit it directly from Postman, I'm getting a content type error, which is weird.
You probably don't appreciate this, but that sounds like maybe headers are not making it through.
Well, this is directly from Postman, so I'm not transforming anything.
Right, I'm just guessing that it might be the same error and that a content type header came from the original source and didn't get passed through. Dragon, is there a content type header you're including in the request?
I think it's application/JSON content type.
I'll tell you in a second. Yeah, that's what it is. And I'm in Postman hitting that EDRS endpoint directly using, I'll tell you exactly what I'm using. Content type of application fire plus JSON. Let me change that to just be application JSON. Now it's going through. Let's see. Well, this is good. I got a bundle response, operation outcome failure, fatal error. Decedent's resident street number has value exceeds maximum length. Value length 18, maximum length 10. That's good. But that was actually sending over the bundle that was sent to California. So let me send over what, Dragon, you had sent directly to them. Oh no, that was what was sent over to, sorry, I keep forgetting the name of it, EDRS. So let me modify that resident street number to make it shorter. But why am I getting an error on that one? You didn't get it, Dragon, directly. This, again, this is direct from Postman to 65.61 URL. Did you step away, Dragon?
Oh, I was talking on mute. So for the 65.61 EDRS endpoint, I am getting a 405 error.
Not when you, I'm sorry, when you go to them directly. Let's forget about the trusted third party. I'm hitting them directly from Postman, and I'm getting a 200, but I'm getting, it says fatal error, element decedent's resident street number has a value exceeds maximum length, value length 18, max length 10. I would think you would get the same.
I have not gone to them directly, so.
Oh, could you attempt that?
Yes, so we would go to 65.61 directly and see what happens.
Yeah. Like I said, I'm just in Postman. I put the 6561, blah, 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 death dash medical, posted in the payload into the body and, set the HTTP headers. And I'm getting this operation outcome response.
Okay, let me see.
And I just pasted in chat what I'm getting back. But I guess I'm a little confused. Status is 200, but within the response, it's saying,
It's just our data quality check. So the record is sent through, but we just want to tell you, hey, this street number is not valid in our system.
okay.
It's not like we reject you.
So Mike, we are getting the same error, Mike.
Okay, that's good. That's always good that we're consistent. But so if you're accepting this and persisting it, I don't see either an HTTP header with a URL, or I don't see in the payload the reference to it. Or is this reference the UUID value? Right, I would expect to get a reference to the resource.
Sorry, our system is not built that way. So for EDR, we just accept the bundle and extract the data. So we don't.
Okay, so I can't do a get because I don't know what the resource ID is. Okay.
No.
And that's by design.
For now.
Yeah. Okay. Well. Okay. Good. I wanted to know what the behavior was without the trusted third party, without the intermediary. So now I could drill down and find out why I'm getting a different error through my through our hub. It'll take me a few minutes, so I'll just
be
quiet.
Yeah. No problem. Thanks, Mike. Okay, we got. So I think is there any endpoint that we have not hit, or anyone that we have not tried to test with so far?
Dragon, this is Alex from working with the CAP. We can send some data to any endpoints. We have a message bundle prepared.
Then I would say that we should send it to the eHealth Exchange endpoint, and they would route it to whatever you have in the message header dot endpoint resource.
Just give me a minute. I'm adding some debug code, and I'm just going to need to recompile. So. Okay, it's ready now.
Okay. And what endpoint do you want me to send it to?
Oh, yeah, I pasted that in the chat. Let me go up top and get it again.
Right, but what message endpoint do you want me to put in the header?
Oh,
You can put in the California Cancer Registry or the EDRS one.
All right, I got the California one handy. And Dragon, is that supposed to go in the source.endpoint? Or oh, it's supposed to go destination.endpoint.
Destination endpoint.
Okay. Sorry, I gotta put it in.
In the destination, on the endpoint.
I could have sworn I just heard somebody playing pool in the background. You know, like someone just broke, but maybe it was another noise.
I'm not sure.
Honest, it wasn't me.
We'd rather be doing this.
So it's coming your way, Mike. I got a 500. And that is because it doesn't like my div.
Let's see.
Hang on, it didn't like an element.
Oh, well, I don't know that it was your error. No, I think it was my error. It looks like it's like the debug command I added was not correct. So hold on. Let me remove that real quick. It failed on my debug.
Okay.
Line. Hold on a second. Recompile. Restart. Okay, sorry about that. Try again.
Oh, sorry, I'm on mute. I had an operation outcome this time. It says that my requested actions not allowed my post of my bundle.
And who was this? You sent this to, let me see. Okay, this was to California.
Yeah.
And yours failed.
Is it because you have to add a bundle at the end or something?
I did not add bundle at the end.
Even we didn't add in one of the case where we got a 200 back, 201 back. So looks like it should work even without the bundle at the end, but you can try with that.
Okay, so we received it and we forwarded it, and it was taking a long time and it just errored out.
Yeah.
We timed out. Do I need to increase the timeout?
Is the timeouts with California, right?
Yeah, I have it set to 30 seconds.
I have someone in another project hitting our fire server pretty hard, so I'm going to try and sort that out.
All right, I'm going to increase the timeout to 60 though. And
I don't know if that's going to help.
Oh,
But
okay.
we'll see. I'm trying to add indexes and stuff to make it faster.
Yeah.
We'll see what happens.
I just did increase it to 60 though. Who's doing the testing though?
Who's
think
sending
Alec-
the bundle? Yeah,
Alex? Okay.
yeah. If you want, I can share the bundle I'm testing with.
Sure.
Okay. And if anyone's curious, in the chat, I'm sharing the reference implementation we generated the bundle with. It just doesn't support the adding the destination field, so I have to add that manually.
Oh, it's prompted for a login.
Yeah, you can log in with any Google account.
Oh, it does say that right here. If you don't have credentials, log in with a Google account. Okay.
I've just dropped our bundle into Slack.
Okay. Is there any other system that we have not hit, or who has not done any testing, who has brought a system for testing? Okay.
Okay, Alex, were you going to resend a test, or are we waiting for?
Oh, I thought we were waiting on Tim.
Okay, we may be.
Yeah, I'm trying to make things work. Give me a second.
And Mike, do I need the slash bundle, or does it process it even without slash bundle?
Well, sorry, that's not a dependency of the intermediary. I mean, we'll pass through whatever's on the app path. It's up to the ultimate receiver fire server, and I do believe you need it for this one.
I think it'll work even without Mike. We just tried it.
I think he tried that and it did not, unless that was another symptom of resource issues.
Because in the one that we did, we didn't add the bundle, so.
Right, and I think that failed. Oh, the one that you did to California, I thought you said you did add bundle. I made that note. I'm taking some notes here.
Okay.
Yeah, you said it was invoked with slash bundle.
Yeah, and one of them, yes. So yeah, I think we did both. So,
Well, again, either way, we're going to pass that through. Yeah, the first test that I believe Alex did resulted in the forbidden, the requested action is not allowed. So we thought that the bundle might be needed.
I'm going to drop off really quick to call someone. It looks like we just need something set up on our side that was missing. So I'll be back in a minute.
thanks, Daniel. Yeah.
Hey, Tim, this is Peter Mello from Intuitive. I was getting ready to send a message your way.
Yeah, I'm down right now. I've got to figure out what's going on.
Oh, okay.
I'm going to be back up in a bit. I need to figure out why the resources are going crazy.
Yeah, I apologize. I've had to deal with a customer issue all morning, so I'm just getting in. Been listening in, but so I think Alex Skoll had posted some endpoints. If there are others that I could.
Peter, why don't you try a request to the eHealth Exchange Hubs endpoint that I had provided, and if you could set the message header destination endpoint to be the EDRS. I mean, we're seeing it fail, but I added more debug, so I'd like to collect more information on that, if you wouldn't mind.
Sure. Where's that?
I'm going to post it. I'm going to post the chat right now. All right, so this is the endpoint to hit, and then the value of the message header destination endpoint would be this. So the first is the endpoint to invoke. The second has to be the value of the payload's message header destination endpoint element.
Okay, great. Thanks.
Mm-hmm.
Sorry, Mike, that second link, the /death medical needs to be the destination.
That needs to be the value of the message header dot destination dot endpoint within the payload.
Okay.
And actually, we have a, well, you could, if you have your own already, that's fine. I could have sent over the payload that Dragon used that already has it in there.
I think I got it. Nope.
It's probably going to fail. That's why I'm trying to troubleshoot why that one is failing, but the other isn't.
Oh yeah, I got a 404.
Okay, let me check. Okay, and this one came back with, oh, you don't put /bundle on the end of it. Like that second URL here, the message header destination endpoint value, just put it in as is. Don't put /bundle. I think they're throwing a different error because of that.
Okay. So I took it out and now I got a 405.
Hey, we keep getting better. Let's see what they say with this one. All right, so that is definitely going over to aha. Okay, I think I see what may be happening. And Dragon, now that I have this debug code in, can you send a request to California? Oh no, you can't send it to California. Timothy's still working on it. Okay. So Peter, can you retry that test?
Yeah, I'm just getting my system configured for your endpoint. So we'll just be a couple more minutes.
Okay.
Mike, did you want me to retry my test? This is Alex.
Well, I'm specifically looking to test the EDRS endpoint. So yeah, whoever could initiate a request through the hub to them. Just if you can give me a heads up when you do.
And the EDRS one is the 65.61.
Yeah, that one.
Okay, I'm doing it right now.
All right, cool, thanks.
It still says it doesn't like the post verb.
Yeah. Okay. Can you try again?
All right, sending. Same.
Yeah. Can you try again? It should fail exactly the same way. I'm just, again, adding debug statements here.
Sure. And sent.
All right, this is Tim. Can someone please try and post to the CCR endpoint?
Yep, Tim, I'm going to try sending you a bundle right now. Tim, I got a 500.
That may be me.
Is there a GUID, Alex, that it returned?
No.
No.
I got
sorry,
it.
Mike, I went directly to Tim.
Okay, because I got another message and unable open socket, so someone else is doing testing too.
Oh, no.
Yeah, Mike, that was me. I just sent a message on, but I got a 500 error. So, am I not sending process message? Am I not adding that to the end of the URL?
That's a question for Dragon. I think he wanted to test that if the responder is able to process it. So you were saying to example.pha.org?
Yeah, this is Sir Dragon here. Sorry, I was distracted a little bit. Can you repeat the question?
I don't know who had the question, but they wanted to know if they should be submitting the process-message directive on the URL.
Oh yeah, it's Peter Vellum. That was me that asked that.
Yeah, that's what the specification calls for. I know we all have different systems right now, but yes, if we are ideally implementing the implementation guide, yeah, we should all be having the process message whenever we are sending and receiving messages.
Hey, Dragon, so Peter's request was targeted to example.pha.org port 80, and when I tried to connect to that, we got unable to open the socket.
No, that's not a real endpoint. That's just a...
Oh no, Mike, I was sending it to your eHealth Exchange endpoint.
Well, and I got it, but the message header destination endpoint of where I was routing that to.
Oh, I see. Oh,
yeah,
I see. Got it. Okay.
Yeah. So yeah, that was just a sample thing in the example. So
That was my fault. I didn't put the right destination endpoint. I'll send that again.
Yeah, hold on. I'm just modifying my code a little to collect more info. Let me just restart the service. And who are you ultimately targeting? I'm ready, by the way, but. Peter, I don't know if you're working on resending another one. I am ready though.
Yeah, I am. It's the destination endpoint's not getting set correctly, so
okay.
Should just be another couple minutes.
No worries.
I can send one in the meantime, Mike.
Okay, great.
Did you want me to set the destination server? Is that 65.61 IP?
I don't know, Timothy. Is that back up and ready? I'm sorry, not that. That's not the California one, is it? Yeah.
Yeah, not yet. I'm not ready. Sorry.
Yeah. Set it to 65. Yeah.
Same 405 message.
Yep. Alex, can you try that test again?
Sure. Same error.
Yep.
Like I just sent another message and got a 404 error this time.
Who was that targeted to?
Well,
Oh, 60.
Yeah.
65, 61. Yeah, let's see. I don't know. I got more debugs coming out. You sent it with the process message. Dragon, does the process message need to be prefixed by bundle? Like, does it need to be /bundle $$ process message?
No, Mike, just the base URL followed by dollar process.
All right, well, that's what I'm sending. That's what's file.
Is the process message supported by the server?
Yeah, if it is not supported, then it will not work, right?
Who hears from EDRS?
Eric?
Eric, do you know, does your server support process message?
Hey, what's the question again?
Does your server support, does the EDRS server support the dollar process message directive?
I'm sorry, what message?
Process message. It's an operation. It's a fire operation.
I put the link in the chat.
Well, not exactly like this. But the endpoint I sent you is basically what we receive the message. but yeah, we don't have like.
So, Eric,
Serializes.
the link that I posted now, this example from the site, this is not a supported operation.
Yes, I know. I'm reading it. I'm saying,
Okay.
There's something like this, but it doesn't like fully. It's not compliant to this like the URL rule and stuff like that. But I'm not like what's the issue here. I mean, I have an endpoint, you just post it.
All right, that makes sense. Dragon, when we did testing with our tool before the Connectathon, we found that many servers don't support process message.
Yeah, that's expected, right? Because unless they're implementing like a MedMorph or some other IGE that specifically asks for it, they wouldn't implement it.
But we found that a number of them didn't even support the message bundle unless you sent it with the /bundle.
Oh, okay.
Yeah.
For the EDRs, it's a also it's not the server is not built on fire. It's just the endpoint is just part of our big application, you know.
So is the 6561 endpoint still available? Because I'm trying to hit it directly from Postman and I can't. So I'm just scratching my head thinking I may be chasing a ghost within the intermediary here when it was successful with California. Is it down now?
California's down right now.
I'm sorry, Timothy. I meant is the 6561 down?
No, it's still there.
Okay.
But you sent I think you sent 3 or 4 bundles already. I don't know why this time it's not working.
Okay, so I'm getting the request URL is invalid, a 400 error.
So what is the URL?
Yeah, oops, I'm pasting it right now into chat. Oops.
Yeah, that is correct. And that's what you said before. I mean, in our log file, I do see.
Well, I'm gonna send a request directly to it from Postman, no intermediary right now with a bundle, and I'm getting a 400 response, bad request, invalid URL. What am I doing wrong?
See, the last bundle was sent on noon 20.
Well, I just sent one right now, and I'm getting this 400 response.
I sent one just now and got what I think may be an expected response.
What am I doing wrong here?
Did you have the content type? Did you set it?
I have content type set to application/JSON. We don't need to add /bundle afterwards, right?
No.
Oh, you know what? I had a special character in the URL here, unprintable character, byproduct of copy paste. All right, yeah, now I'm getting that, just the warning about the residence number. Okay. Phew.
Yep, just see the bundle sent in at 1:16 p.m.
Yeah.
At 1:18. So I'm sorry, I think 1:16 is Epic and just 1:18 is yours.
All right, time to turn on my good friend Wireshark.
All right, this is Tim. We're back online. There's a new URL they posted in the chat. I'll also post it on Slack.
Tim, I sent you a bundle and I got a response.
Okay, let me see if I can query it. 1 second.
I posted the URL for it in the chat.
Okay, thank you. And the patient name is Joel Alex Patient. Or Joe Rodriguez.
Yeah.
Okay.
Okay, we'll do a recap in about 5 minutes on where we are and see if we have done everything that we wanted to do or if there are things that we can do based on where we are. So in about 5 minutes, I think we'll try to do a review of everything.
Hey, Tim, I just sent to that endpoint with the processed message on the end. I just messaged you in chat what the URL was that the payload was, what the URL for the payload was. So I got a not a 404 error. Just wanted to make sure that was correct as far as submitting to you. Yeah, so Tim, sorry. I see your message. So I sent you the URL that I was posting the payload to.
Okay, yeah, I'm back now, so sorry about that.
Oh yeah, no problem. I just I got a 404 error, so I was just confirming that was the correct URL.
I'm not sure. Is that per the fire spec for process message?
Well, yeah, I mean that's what I've been using.
Okay, let me.
But I don't. But I can. I mean, I can remove it and send it just to the base if you want.
Just as a bundle.
Yeah, it's a bundle, right? It's a message bundle, message header, and the.
We could try that for now, and then I'll see what's going on with the process message and if it's supported or not.
Okay. All right, I'll send it again then. Thanks.
Okay, I think it's about 1:30. Shall we do a review of where we are and what we have done? If everyone is okay with the activities.
That sounds good to me, Dragon. I think I found what the issue I have with, this is Mike, not being able to handle the 6531 EDRS. I'll work on getting that resolved.
What is that? Any idea what's?
Yeah, oh no, I definitely know. Thanks for everyone helping to continue to test. But now I'm able to test from Postman. It's a mishandling of the application path.
Okay. Okay. So let's do a quick review and see where we are. I don't know if I can be the presenter or not. Let me try. I will. Okay, somebody has to make me the host, I think. Let me read.
I think you should be able to just hit share. I don't think you need to be made host, do you?
That's what it told me.
No, okay.
Maria, Amit, would one of you hosts be able to do that for Dragon?
Sorry, can you repeat the request?
Maria, yeah, can you make Dragon the a presenter so he can share his screen?
Oh, let me see.
I think you're listed as host, so.
I think I just gave that to Dragon.
Thank you.
Mm-hmm.
Hey, thank you. So just try to create some quick slides to review where we are, what we have done and what we have not been able to do so far. So hopefully you guys can see my screen. So I know we set out with a very aggressive schedule to kind of achieve testing of a number of actors, all the way from like an EHR to a backend service app to a TTP and a registry. So, we have been working with Epic as the EHR instance. There are two instances. One is the Fire Sandbox that is open and available. The other one is the IHE instance. So for this particular Connectathon, we wanted to generate a A08 death notification, and that would be sent out as an ADT message to the University of Washington processor. So that was tested, I believe. And I think, Paul, you can confirm if there is anything that is pending in this line. Everything I
Nothing
think.
pending. That's all functional to the best of my knowledge.
Okay, so that's good. So that's done. And then from there on, the UWADT processor would notify the backend service app to go back to Epic and grab the data. So we know that we tried to notify with this Epic IHE instance, but it didn't work because of the authorization failures. So we tried to do a notification with the Epic Fire Sandbox instead. So the notification worked, and the BSA is able to pull the data from the Epic Fire Sandbox, but this sandbox doesn't have the test patients that we need. So we just grabbed a sample patient and an encounter and tested that this works. This particular one is failure where we are not able to get authorized to the EHR to query the data. So I think Epic is looking into this issue right now. So once the backend service app creates the data using this test sandbox and bundle, it forwarded the data to TTP to both the EDRS and the cancer registry. We have seen intermittent successes and failures. Like for example, on the EDRS, we know messages were received, but validation failures were experienced. And then on the cancer registry, messages were received, there were timeouts. And the same path was tested by the CAP team by sending messages to both EDRS and the cancer registry. And I think similar results are coming up, which is what Mike Y has been debugging for the last half an hour. Is this an accurate depiction of what we have done so far? Is there anything that I've not covered?
Dragon, it looks like Mtuitive is missing Peter Mello.
Oh, okay.
And the testing he did, he did a similar role to the CAP SDC app.
Okay, I will add that in.
Thank you.
Yeah, sorry about that, Peter. So many voices going on. So.
Oh, it's quite all right. Appreciate you doing it.
So correct that. So that's essentially, I think, what we have been doing so far. So, given that we just started this like 2 days back, I think this is pretty good for 2 days. I think. So a bunch of lessons learned. So we did have content type issues that we saw, application JSON or application Fire plus JSON. It should be application Fire plus JSON, but servers should implement both so that they can accept both. So, so that's something that I think, again, we will try to emphasize in the implementation guide. The Ssl handshake issue. So that is, again, a lesson learned to kind of, prior to the Connectathon, making sure that the certificates, if we are using, are working before the Connectathon so that we avoid that issue. Process message not implemented by most servers, pretty much. So that is what with the implementation guide asks for consistency and interoperability.
Dragon, I have a question about that one.
Go ahead.
So in the Fire spec, when you submit a bundle to just the endpoint without any /bundle, it's assumed that the bundle is going to be processed by the Fire server into its individual resources. That doesn't appear to happen with any of the Fire servers that we tested except test.fire.org. And so if in our testing, what we found is that most servers only support the message bundle if you end the base with the /bundle URL. So you have to preserve the whole structure of the bundle instead of letting it be processed in any way, shape, or form. So I think it goes beyond just the process message operation. And like supportive message bundle.
What you're saying is the processing of the message also is not consistent.
Yeah, of the bundle type message is not consistent, is how I would say it.
Okay, so I think we'll add some more material around it in our IG. So the other thing that we did learn is the ADT feeds, if they're going to be used for notifications in general, the fire identifiers that are required for the backend service app to establish context are not always the same IDs that come in, like the ADT feeds. The ADT feeds typically have MRNs. So I think that's something that we should put some information in the IG as context, if they want to use alternative notification mechanisms that, they need to be aware of this.
And I guess I'd want to note real quick that the HL7 being sent has room for that. There's multiple PID fields. They just aren't all populated. And you can certainly define, the system and whatnot. So
Yeah.
I think that's just an issue of having those defined in the EHR and having the EHR include that in the ADT message. And then, of course, the connector will parse and send that on.
Yep. So that's something that we'll have to think through if we are going to pursue this method. Oops. Okay. Then the next one is the Smart on Fire backend services authorization. We were able to do this successfully with the Epic Fire Sandbox. Just the IHE instance had an issue. So we know that it works, and when it works pretty well. So as long as we all stick to the same specs, I think we'll be good. In terms of the EDRS, I think looks like there's validation of data that may or may not even be known to the EHRs who are submitting the data or the backend service app. So at some point, if this use case is going to be converted into content IG, there is a lot of validations that needs to be exposed. Then on the registry side, the performance is what we experienced to avoid timeouts. I don't know that this might be just a testing artifact, testing issue, not a production thing. Anything else that I missed in terms of things that we did and experienced and is captured or not captured? Okay, so I think we're getting close towards the end of the Connectathon. Are there things that we can do that will help us in the next 20 minutes to do something? We can go all the way up to 2 and see if there is anything else that we can learn from the next 20 minutes, and then maybe have a check-in at 2 to see if there is anything else that we can do, or wrap up.
Dragon, this is Dee Dee. Are there plans to do a Connectathon track at the HL7 Fire Connectathon in May for this track?
Yes.
It might be good to plan what additional pieces that need to be tested or planned for that track. I don't know if it's too early, but
it's never too early.
That's what I kind of figured, that it might not, since you have a captive audience and you can set expectations and reach consensus on what you're going to focus on, it might be good to spend some other time doing that.
Yeah. And can you go back to the EDRS issue? And I didn't quite follow that second to last bullet there. Validation of data may not be known to clients submitting data. What is
the validation that we are experiencing is like, the street address can only be X number of characters long. I don't know if that is a valid, I've not come across anything like that in any of the US Code Fire implementation guides or any of the other implementation guides. So the data that, one can expect in EHRs may not be constrained to that constraint, if you will. So,
right. And Eric, is that something that came from the IGs we've been working on in death reporting? Do you know?
I don't know. I just saw this in testing.
Yeah, I was asking Eric if he knows if they're good. I'm just wondering if there's some follow-up we should do for the death reporting.
right before this, sorry, this is Chad. Right before we started doing this wrap up, Eric ran and grabbed food quick, so he might be back in a second, but I'll text him and get an answer.
Yep. Okay, well, you should be able to continue going through like Dee Dee suggested.
Okay, so we can just continue with that. So for the HL7 Connectathon in May, definitely we want to be a lot more structured, and I think the big area that one of the areas that we really want to focus on is the EHR integration with the subscriptions, if we can. That is an area that we have not done a lot with. So that's one area that we want to kind of focus on. Also, we want to focus on the plan definition, automated processing. I know we have done some, but we want to really get that knowledge artifact processing completely ironed out, where we have 3, 4, 5 different plan definitions that we can execute in a single backend service app. I think those are the two areas that I think are very, needs a lot more attention and testing. I mean, of course, when we have all the other actors, we will test the other pieces as a byproduct. But the areas that we haven't touched on is those two areas that we should really plan to get some traction and testing on. And then the rest of the things that we need to continue in terms of getting a structure out. In the previous HL7 Connectathon, we had laid out a set of structures where time slots for testing each of the workflows and each of the interactions, and who the actors were and what the APIs were, and so on and so forth. So I'm assuming the same kind of structure that we have used previously on the HL7 Connectathon we can use. But I'm open to suggestions and ideas and what people think we should focus on at the May Connectathon. So would like to take notes if any of you want to offer up suggestions that we can follow and improve.
It seems like, the workflow is starting to build out, kind of an end-to-end plan, but the level you've got the boxes, it seems like you've got maybe a connection test and a content test maybe needed for each of those steps.
Definitely true. Definitely we need both for each step. Mm-hmm. Connection and content both. So we can segregate that and kind of hit the APIs independently at the Connectathon itself, so that we know that everybody is connected. And then at the Connectathon, we can just focus on content.
And it sounded like you're encouraging EMRs to test with subscription, but I don't know if that's going to be feasible.
Yeah, it's a tough thing, especially with everybody trying to get certification done. But that's an area that, we're thinking, again, this is all just thinking right now. It's not crystallized. There will be normally a subscriptions track at HL7 Connectathon. So, we might just piggyback on the track to get some testing done.
Hey, Dragon, this is Peter. I just had a quick question. Yesterday, you posted a couple of resources. One was your example of a reporting bundle containing message header and content.
Yep.
So that's what I've been modeling the payload. That's what I've been using to model that. That's accurate, right? I'm assuming that's what we should be.
Yeah, it is accurate. The only thing that I would say is we are going through ballot reconciliation, and during ballot reconciliation there might be things that might be added or removed, but as of now that's the baseline.
Oh, all right. Just wanted to double check. Thank you.
Hey, Lori, it's Chad. I just got confirmation from Eric about the EDRS piece with the number of fields for the address. It's not in implementation guides. It's due to the restriction of the EDRS system itself. The number of fields that are available.
Okay. So you would have to truncate something on read or whatever, right?
Yeah, I'm assuming it would have to happen in some sort of respect like that, or because typically the EDRSs are built towards the, for the states, so they kind of tell us how many fields have to be in there at times.
So nothing completely obvious, but it seems like there should be at least some guidance so that if this is a direction, go that way.
Yeah, some direction on how to handle that piece if it comes in longer would be good.
Okay. Any other thoughts, comments from anyone?
Hey, Dragon, this is Cindy Bush. You might have already mentioned this, but was there anything generated for the healthcare surveys that came out of the testing?
No, Cindy, because we don't have any specific test data or test patients. I mean, we have a test bundle that is not just, there is no specific data that is set up for survey itself. I mean, we generated a bundle out of the Epic Fire Sandbox using a test patient that we can ship to you, but there's nothing, data wise, I don't know what data elements you're looking for.
Yeah, it would be helpful if you could ship it, then we could kind of like take a look. I know you don't have the test data we provided, but
exactly. So I can send the data that we generated, and then you can take a look at how the bundles are organized and what resources are present.
Yeah, that'll be good. Okay. Thank you.
And hey, folks, this is Amit. In the spirit of thinking about what else can we do to plan for the Fire Connectathon, I hear the message on trying to recruit vendors and all that they have going on. But whatever we can do to maybe simplify that for them, that might be helpful. And I think we'd be happy to help promote that and try to recruit some more testing partners. So I think high-level overviews, any kind of quick links, sample data, patient data, that kind of stuff all helps. And especially as we get to testing and all the different folks that are playing a role in here, having some unified sets of patient data or information that various actors need will be helpful. The other thing I was going to ask is if there's any need for any kind of specific other validators or tools to support the testing, please try to raise those issues as well so that we can see what we can do ahead of time to bring some of those folks together and see if we can support that type of testing as well.
Yeah. Thanks, Amit. Yeah, we'll definitely probably reach out again.
And I know some of my team is on other sessions. There's a number of things going on this afternoon. However, we are looking forward to maybe a deeper dive in a future call with the TAP or anyone who's participating in this. So I invite everybody to reach out if you can, and let's see how we can help if we can.
Okay, so definitely looking forward to the interactions. So let's see if we can improve for next time around and do more testing. Hopefully we can recruit more partners, maybe pilot participants and others. So okay, I think we're almost close to 2. Is there anything that do we want to continue beyond 2? Is there anyone who wants to continue beyond 2? Anything that we can gain from hanging around?
So Dragon, I just got a message from Aaron. There was some IP routing on the Epic side that may not have been set up correctly. So you might be able to try that IHE instance endpoint again and see if it works.
Okay, so do you want us to hang around and for some more time and try it out, or do you want us want to notify via email and you want us to try?
Probably by email, since Aaron and Danielle aren't on this call and I won't be able to help very much.
Okay, you can send an email and we'll try to hit it. Hopefully the instance will be up for another day.
Jacob, I believe we could test that if you want to simply transmit one to the UW processor with a death notification, a death date time, as we discussed yesterday. It should trickle right through.
Okay,
yeah.
Let me do that real quick.
Yeah, I mean, we can test it out. For the first thing that we will do is basically test it out using Postman to see if we can get the access tokens and everything. So.
And Dragon, I was going to mention, for what it's worth, we don't have to have a hard stop at 2. You're a host of the session too, so we can keep it open as long as you need.
Okay. Yeah, I mean, I'll keep it open. If anybody is interested in testing more and doing stuff, otherwise, we could give some time back to everyone.
Yeah, you definitely don't need to keep it open indefinitely, otherwise.
Yeah,
it's been a good day so far.
Yeah, catch up on all the daytime jobs that
I
everybody.
do know that the surveys program would appreciate it if you were able to manage to make that connection and create something. I don't know if that's feasible, or I know with Connectathon week we're still going, so.
So I think if you get a notification, via email or something, we'll try it out and we'll hit it. We know that the notify works, so as soon as if we can make it happen, we will be able to generate the data for sure. So.
So Jacob did send me a message. We passed it through. Same result at this point, Dragon. So let us know what error you see.
Yeah, I will. Yeah, I need to log into another server and check it out. So. Okay. So Jacob, maybe what we can do is we will try it out offline and then respond to you via email, and then maybe we can go according to the email.
Yeah, just like I said, Aaron and Danielle, so make sure they're on the email because they'll be the ones that can help with fire stuff. So.
Okay, I will do so.
All right, so as we're wrapping up, just wanted to mention, Dragon, let me know if you need anything else. We can set up anything ad hoc the rest of the week. We'll have the Slack channels available for folks for a couple of weeks at least. So you have that venue as well to communicate.
Yeah.
Hey, Dragon, this is Mike at eHealth Exchange. I have a question. I put the fixes in to support both of those 2 target destinations, but I have a question about the message header destination endpoint. Like California.
Hello? I got it. It's out. I got it.
Yeah. Well, I'm just wondering though, where does the /bundle, where should that be put?
I just figured it out.
It shouldn't be put at all.
Well, it's required, like by California Cancer Registry. They throw a.
Yeah, I mean, but it's all related to the endpoint that is being implemented, right? Everyone should be implementing the process message endpoint at the root server URL.
But here, I guess my question is, as a trusted third party, I'm either going to use the destination.endpoint value as is, and maybe the /bundle would be there. But is there ever a scenario where the /bundle would be attached or added as a suffix to the trusted third party service endpoint?
No. You shouldn't be doing anything. You just take the endpoint and just send it to that endpoint. That's it.
Okay. All right. Well, then a minute too soon, but I finally got And Alex helped me test both of those scenarios. Thank you, Alex.
Okay.
So, Dragon, I actually have a question about this.
Go ahead.
Because the way the spec is written, Mike's endpoint, I think, should have the / bundle. And then the CCR as the destination endpoint should not. Because the point is that we want to send it to Mike, and he'll maintain the structure of the message bundle and forward it to the CCR, who will process it. And by posting it to / bundle, it means the bundle's not going to be taken apart.
Okay, so what you're saying is for the trusted third party, right now we are defining the same operation, which is the bundle process message. And you're
Well,
saying,
what I'm saying is that for the trusted third party, it might not be a process message. It might be a maintenance of the bundle, preserving the bundle.
you're just saying expose a bundle endpoint with a post operation.
Yeah, and then it's on the CCR in this case to process the message, not on Mike, right?
They have to process the bundle and extract the message header and then take the endpoint and then forward it. I think it's a good point. I think what we could do, Alex, is open up a ticket in the MedMorph Jira spec and kind of discuss and understand, what we need to do from a standard standpoint.
Right.
Whether we should a bundle post or whether we should have a process message. Right now, the spec is process message.
So
can you open up a ticket?
Actually,
or you want us?
I can open.
I'll capture it right now so we can go back and look at it.
Okay, I see. So what you're saying, Dragon, is I should be expecting as the sender to send it to Mike with a message header dash process message.
Yeah, that's essentially what I'm saying.
And then Mike should, according to the process message operation definition, Mike can choose whether he is retaining all the resources or just forwarding it according to the definition of the message header.
And I think I'd noted this earlier, because our pass-through right now are just RESTful based services, we're not, other than interrogating the JSON to get the message header endpoint value, we're not taking any action on the content.
Also, in that case, let me share what I'm looking at. Should the accepted code be a 204? To say that you've taken custody of the message rather than processing of the message, Mike?
Perhaps. Although the 200 code is really, again, being passed back through the third party as just a proxy. So I'm not sure. If we threw a code internally, you know, before we had internal processing error, well, then I could see us setting that value, setting the response code. Otherwise, I think if we have a successful connection to the ultimate receiver, or at least the next intermediary, if there's multiple, that we would return whatever we receive from them.
Also check on the return response codes that are appropriate. Processing. So, okay. So we have created this ticket. Related pages. Okay, anything else that anyone want to discuss?
Dragon, also to clarify, when I send a bundle to a base URL without specifying a process message operation, specifically a message bundle, am I expecting that bundle to be processed by the receiver? Because with a transaction bundle, that's what I would expect, is that each individual resource would get processed.
Can you repeat that, Alex?
Sure. So if I'm sending a transaction bundle just to a base,
yeah,
like a base URL, I expect the transaction bundle to be completely processed. And for the message bundle, do I expect that same processing to happen if I send it just to the base URL?
When you say completely processed on a transaction bundle, splitting it into all its component resources and stuff like that?
Yeah.
Oh, okay. We have to go back and check the messaging specification to see what it says. I don't believe that is the case, but.
Yeah, I don't think it is either, but I'm just wondering what the expected behavior would be.
Delivered from one application to another, and then one or more responses. So we have set it up as currency. That's what we have set it up. Response to query for current information. Oh, let me check which one we have set it up as. Yeah, we'll have to probably review this to understand. Accepts a messages, process it according to the definition of the event in the message header and returns one or more responses. So that's what it says. Okay. Accepts a message, event in the message header and returns one or more responses in addition to processing the message event. So it gives it, it's optional, is what it's saying.
It gives the receiver the option?
Yep. So it says 200 okay, 202 accepted. So it's basically, you can do. So in our thing,
So if I send to a base/process message, or just to a base, and I'm sending a message bundle, I should expect the same behavior from the server.
I wouldn't go there, right? Because sending a message to the base URL, I don't know what that means. Is that defined anywhere?
It's defined for other types of bundles. I just don't know what it is defined for
A message bundle.
Yeah.
Yeah,
And
I
if
have
you do
not.
that, and if you do that against test.fire.org, it does process your message.
Okay, interesting. Yeah, I have not looked into, what that means for the messaging bundle. But I don't think we should give that many alternatives or options. I would say that we should constrain it to one specific method of sending and receiving. So we have consequence here in one of them. Message processing category. Yeah, I think all of them are options. So I think people can choose how they want to implement and what the clients can request. So not sure that it is as constrained. Anyway, we can take the ticket and discuss that in a broader forum with more expertise and see what we need to do. Okay. Anything else from anyone? Any other topics that we want to discuss?
Well, Dragon, this is Mike. If there's no other topics, everybody from CDC had to drop, but Maria and Wendy and the whole MedMorph team wanted us to pass along their thanks to everybody for joining, all the testers, all the preparation for this meeting, all the work you've done here today. And they just wanted us to let you know too that they're really looking forward to working with everybody in the future. So a big thanks all around to everybody for making this happen, especially on short notice.
Thank you, Mike. Thank you, Dragon. Thank you, everyone who participated. And I do appreciate all the effort on short notice and being able to bring you guys to the Connectathon. And I look forward to working with all of you more in the future.
Yeah.
So that said, please let us know if there's anything else we can do to help.
Should have included you, Amit. Thanks to Amit and his team, Sarah and everybody for all your work on the prep as well.
You bet, our pleasure.
Yeah, thank you, everyone. Can somebody capture the notes, Mike, in the chat and copy it?
I had the chat and the Slack channel. So if you would send those 2 slides as well, we'll put it all together into a package.
Excellent.
Thank you. Thank you, everyone. Appreciate it. Take care,
Have a
bye-bye.
great day.
Thanks, Dragon. Thanks, everyone.
Thank you all.
Thanks.
So.
Hey, Raghu. Yeah, do you want to try the Epic one last time and